Tell me about your father's eating problem.
Food was always important to my father. He was an extremely successful businessman, but he was always home for dinner, except when he was traveling. I remember him coming home and my mother would always have a big meal waiting for him, beginning with a scotch and appetizers. Dinner would last hours until I needed to do my homework and go to bed. He was so happy, his family beside him in a big supper. As his Alzheimer's disease progressed, Dad became less interested in eating and began losing weight. I could still get him to drink scotch and wine when we sat down for dinner, but he wouldn't touch his meal other than a few bites and only when we prompted him.
What did you do to try to help him?
As he began to lose weight, I asked his doctor about appetite stimulants, and he said there weren't any that are safe and have been proven effective for persons with dementia. So I asked about medical marijuana, and although he said there is some evidence for it stimulating appetite in AIDS patients, it hasn't been studied in persons with dementia. He said if we wanted to try it, that he was willing to write a prescription. I had to laugh because Dad was so anti-drug when we were growing up, and now we were going to be getting him high. So we tried it, but unfortunately it didn't work.
Did the doctor have any other suggestions?
He looked at my father's medications and stopped one or two that might contribute to decreased appetite. That didn't help either. Finally, we talked about Dad's diet. First, the doctor had us taper his alcohol, substituting alcohol-free wine and beer. The doctor also said that because of his Alzheimer's, the benefit of a low cholesterol diet wouldn't be much. He also said Dad's diabetes wasn't that severe, and new guidelines allow for his blood sugars to run a bit higher, so we allowed him to eat foods he likes more. Now, that helped a lot. He really took to gelato. And it's funny, once he began to eat, he started eating more like he remembered that he's supposed to eat.
Was there anything else you did?
The doctor also suggested that we take ownership of his eating and not rely on Dad to take the initiative. It was basically providing closer supervision to make sure his meal was set up and he knew he was supposed to be eating. Sometimes we needed to remind him every few minutes to take a bite of food. And the doctor also advised us not to force him to clean the plate every meal. Rather, he said give him between meal snacks. We began with supplements from the store, but found milkshakes worked just as well, especially if we mixed a banana in. Dad began to gain weight, and we don't need to give him the snacks anymore, except of course on special occasions.
Is there anything that you would have done different?
We probably would have mentioned the problem to his doctor earlier and not waited until he was losing weight.
Do you have any advice for others?
Although the getting food in Dad crisis is over, his eating's not back to usual. Instead, it's a new normal that we needed to adjust to. Mealtimes aren't the same, but things are definitely better, and I worry a lot less about his eating.